Okay, everyone, good morning. It's 10 o'clock. We'll get started here. First, I'd like to introduce the Fire Prevention Chief, Brenda McNorton. She's going to do an introduction.
Good morning, everyone. We wanted to just take a minute to go over the CMS waiver lift that they're doing so that we make sure everyone is back on track from COVID. And at any point in time, if you guys have questions, feel free to ask. And John will kind of monitor everything we need to do and make sure we have all your questions answered as we get started. Thank you, John. Go ahead.
I'm going to share my screen here. All right, can you see the presentation right now?
Yes, we can see it, John.
Okay, thank you. All right, so as Brenda said, we're going to talk about 1135 waivers, that have been lifted. So first, CMS has released a series of changes for certain types of facilities, and that's one of the key things here. Another sign of improvement for the current COVID-19 pandemic, while not eradicated, cases are on the decline, has led to a change in CMS guidelines. CMS 1135 waivers are still in place for hospitals and critical access hospitals, CAHs. Over the course of the COVID-19 public health emergency, skilled nursing facilities, we typically call SNFs, and nursing facilities, inpatient hospices, intermediate care facilities for individuals with intellectual disabilities, and end-stage renal disease, ESRD facilities have developed policies or other practices that we believe, and this is CMS saying this, mitigate the need for certain waivers. Background. In the response to COVID-19, the Secretary set out sections 1135 of the Social Security Act. CMS enacted several temporary emergency declaration blanket waivers, which are intended to provide healthcare providers with extra flexibility required to respond to the COVID-19 pandemic. CMS continues to evaluate the impact of these waivers on patient care and providers, along with corresponding data. Reason for the change that we're discussing today, findings from on-site surveys have revealed significant concerns with resident care that are unrelated to infection control. Again, here's some reasons for change. Resident care surveys found that abuse, weight loss, depression, and pressure ulcers were present. There's concern by CMS that the waiver of certain regulatory requirements has contributed to these outcomes and raises risk of other issues. Examples are waiving requirements for training, nurse aides, and paid feeding assistants may not have received the necessary training to help identify and prevent weight loss. Another example, CMS waived requirements for physicians and practitioners to perform in-person assessments, which may have prevented these individuals from performing on an accurate assessment. And these are going to be waivers that are ending in 60 days. And we'll get into what that date is in just a moment. So the memorandum that came out, and I put in the chat, sorry, I didn't mention this earlier, in the chat, the original waiver from CMS, and also a copy of these slides if you need them for reference. Emergency blanket declarations for various provider types ending 60 days from the publication of the memorandum from CMS, which was April 7th. So we're looking at June 7th for these ending. All right, and emergency blanket waivers for physical environments for SNFs and nursing facilities. This was the requirement to allow for a non-SNF building to be temporarily certified for available for use by a SNF in the event there were needs for isolation isolation processes for COVID-19 positive residents, which may not be feasible in the existing SNF structure, to ensure care and services during treatment for COVID-19, provided that the state has approved the location as one that sufficiently addresses safety and comfort for patients and staff. Certain conditions of participation and certification requirements for opening a nursing facility if the state determines there is a need to quickly stand up a temporary COVID-19 isolation and treatment location, and requirements to temporarily allow for rooms in a long-term care facility not only used as a residence room to be used to accommodate beds and residents for resident care and emergencies and situations needed to help with surge capacity. And here we can do some inspection, testing, and maintenance changes. Fire safety inspections for ESRD facilities. You can see the code there that we're talking about, the federal regulation. CMS waived the requirements for on-time preventive maintenance of dialysis machines and ancillary dialysis equipment. Additional, CMS waived the requirements for ESRD facilities to conduct on-time fire inspections. Facility and medical equipment inspection, testing, and maintenance for inpatient hospice, ICF, IIDs, and SNFs and nursing facilities. City codes where CMS waived ITM requirements for facility and medical equipment to reduce disruption of patient care and potential exposure transmission of COVID. And also ITM for inpatient hospice. CMS waived ITM required by Life Safety Code and the Health Code with specific exceptions which permitted facilities to adjust scheduled ITM frequencies and activities to the extent necessary. Again, these are going to be ending in June. And here's more 60-day waivers. CMS waived the requirement to have an outside window or outside door in every sleeping room. This goes back to certifying areas for mitigating the risk of COVID that would not qualify as a sleeping room in these facilities now. And this permitted space is not normally used for patient care to be utilized for patient care on quarantine. So that is lifting. And fire drills, due to the invisibility of quarterly fire drills that move and mass staff together, CMS permitted a documented orientation training program related to the current fire plan, which considered current facility conditions. CMS waived requirements that would otherwise not permit temporary walls and barriers between patients. That's under temporary construction. All right, and these are going to be nurse aid waivers lifted June 7th. In-service training for long-term care facilities. CMS modified the nurse aid training requirements for SNFs and NIFs, which required 12 hours of in-service training annually. CMS waived the requirements that require a SNF and NIF may not employ anyone for longer than 4 months unless they met training and certification requirements under the code. CMS previously provided information related to nurses' aides working under this blanket waiver in CMS, the memorandum mentioned there. This memo provides additional information as well as the modification of the waiver below. We recommend states that all nurse aides, including those hired under the above blanket waiver, must complete a state-approved nurse aid competency evaluation program, NATCEP, to become a certified nurse aide. Sorry, just all right. State-approved NATCEPs must have curriculum that include training in the areas defined in the code, such as respecting patients' rights, basic nursing skills, personal care skills, the caring of cognitively impaired residents. Additionally, the requirements of 42 CFR 483154 1 and 2 require these nurse aides pass a written oral exam, demonstrate skills learned. Lastly, we note that CMS did not waive the requirement that the individual employed as a nurse aide be competent to provide nursing and nursing related services, and that requirement must continue to be met. We are aware there may be instances where the volume of aides that must complete a state-approved NATCEP exceed the available capacity for enrollees in a training program or taking the exam. This may cause delays in nurses' aides becoming certified. If a facility or nurse aide has documentation that demonstrates their attempts to complete their training and testing, for example, timely contacts to state officials, multiple attempts to enroll in a program or test, a waiver of these requirements is still available, and the aide may continue to work in the facility while continue to attempt to become certified as soon as possible. However, for all other situations, this waiver is terminated. When capacity issues exist, facilities should inform their state officials of the issues. State agencies should also verify the capacity issues that are reported. Lastly, state agencies should provide their CMS location with information about the status of their NATCEPs. What we're seeing happening is poor quality of care, such as improper transfers, turning and positioning, poor incontinent skin care, or weight loss due to poor assisted dining techniques could be related to inadequate training. As these skills are required components of NATCEP programs, we acknowledge that the federal requirement allows states to use a variety of means to administer their curriculum, online or classroom. However, all programs must adequately provide the training, the required training. For example, if a state has approved NATCEP that allows for the time worked on site by nurses aide over the COVID-19 public health emergency to qualify for 75 hours training in the required areas, yet observes trends and poor quality of care among certified nurse aides that were hired under the nurse aide training waiver. This would indicate that the NATCEP does not adequately address the components of the required curriculum specified in the code. In these cases, the state should reevaluate the approved NATCEP and see if the components of the program need to be adjusted to ensure the regulatory requirements are met and avoid poor quality of care. As stated in CMS, the memorandum mentioned there, states must ensure that all the required areas of training per 42 CFR 483.152B are addressed, and any gaps in on-site training that are identified are fulfilled through supplemental training. And here are some email addresses for more information. Here's my information. If you need to contact me, you can certainly speak to me about this too. We'll try to, it's clear as mud as it comes out, but we can get you an answer if we need to. So any questions? Okay, we have one question from Jason. If you look in the chat, if you look farther up in the chat, I have put a PDF of the slides in there. It's the 1135 waiver adjustments. That's the presentation I just did. Any other questions? Just a reminder, I put the release from CMS and also the slides that we went through today in the chat. Yes, that's correct. Wilkie. Critical access hospitals and hospitals still have the 1135 waiver in place. CMS, to my understanding, has no intention of removing those for now. Okay, we've got another question. How is this temporary nurse aid waiver related to the state of Kansas law extending temporary nurse aides until next year?
John, I'll go ahead and take that
Yes,
one.
thank you.
Anything that deals specifically with your nurse aid side or any of the nursing portion of it, we ask that you go ahead and contact KDADS or KDHE, since they are your licensing agency and they deal specifically with that side. We will only address anything that is on the life safety code side. So if you have questions about the life safety code side, we'd be more than happy to answer those for you.
And some of this information certainly it wasn't on the life safety code side, but we just wanted to try to explain to you best we could. And we know that that's our other part of, KDADS. Okay, I can put it back in the chat now. Yeah, I can't minimize the Zoom.
And if you guys have problems downloading the information, go ahead and send John an email and he can directly send that to you if you can't get it off the chat.
Yes, I'm putting my email address in now.
That way we'll make sure everybody gets the information. And as we proceed forward, just remember your inspection, testing, and maintenance on any of your sprinkler systems, fire alarm, doors, any of those that are required on the life safety code side. Make sure you start to pick those back up by June 7th. As you know, our inspectors, when they come out to do your survey, they will be looking for those specific, that specific information from your vendors. So if you have questions on what is required, email us and then we will get that information out to you as soon as we can.
We had another question. Will there be a follow-up from CMS on when we have to have in a long-term care unit conduct tabletop full facility exercises? I guess that was from Chip. You may want to unmute yourself and clarify that a little bit. Do you mean going from tabletop to a full, fire drill or?
So any tabletop exercises that's in your emergency preparedness plan will now pick up and start just the same as your inspection, testing, and maintenance. So make sure you get those back into the mode of putting everything that you're going to need as documentation. And like we said, if you need anything else, feel free to reach out to us and we'll get those completed for you.
And I guess what's a retro date for these inspections? I would, well, Brent, I don't know if you want to take that. I would think it's been waivered. So,
The 1135 waiver stays in place until June 7th. However, they put the information out, giving you time to start preparing and getting that information or those inspections implemented again into your process. So if it was me from a standpoint of a facility, I would go ahead and start getting those inspection, testing, and maintenance items up to date. And then that way you have all that information and you're not frantically trying to do it all by June the 7th. So I would start your process now, even though they're still in effect till June the 7th, but that gives you plenty of time to get everything scheduled and have those vendors start coming back in. Yes, the date is June the 7th for everything.
anybody else with questions or anything else? Well, again, as my chief had mentioned, you can reach out to us anytime. We'll get you an answer about any part of the code, not just this, but anything. That's what we're here to do. And certainly my email address is in there. You can email me. And if I don't have the answer or you need to go to a different department, I can get you there, forward it on. So we can take care of any of your needs here in the office. But if nobody else has anything, I guess we'll conclude this session. Just a reminder, I'll send a notice out. We have May 19th. We're going to have all about natural gas. Greg Knoll from it's another acronym. Sorry, I'm not good. PCAP, PGAC. Anyway, he'll be talking about natural gas. Propane, actually. Sorry. And there we go. And there's Brenda's email as well if you have questions. Well, on that note, we'll end the session today. And again, just follow up if you have any questions. Thank you for attending. We had a good group, and everybody have a great rest of your day. Okay, we'll do. I see that email in there. Everybody else wants to put their email address in there, and I could send the notices of these trainings that we have when we have them. I'll stay on here for you to do that. All right, that's it, gentlemen. I'm going to end the session. Everybody have a great day.